Managing diabetes naturally requires a multifaceted approach to lifestyle changes, lifestyle modification, dietary changes, and also natural remedies. We are discussing diabetes today. We'll get to know how the disease comes about, the normal ranges you have to stay within, and natural ways by which you can live with diabetes and be okay. Stay tuned. Diabetes is a group of metabolic disorders characterized by high blood sugar levels or high blood glucose levels in the blood. It can cause complications if left untreated or poorly managed. Normally, when we eat, carbohydrate is broken down by the body into glucose, and then it is absorbed into the bloodstream. In the bloodstream, insulin will now facilitate the entry of the glucose into body cells where it can be stored for energy or it can be stored for later use. Now let's talk about the ranges one has to stay within. For people without diabetes, a healthy fasting blood sugar level should be between 3.9 to 5.5. That is, if you've not eaten, the blood sugar level you have to get when checked is between 3.9 to 5.5. However, a range of 2.8 to 3.9 can also be considered normal whilst you haven't eaten and checked for blood sugar level. If you are getting 5.6 to 6.9, then we can say that you are having pre-diabetes or you are at a higher risk of developing type 2 diabetes. If you are having 7.0 millimole per liter, you may have diabetes. However, it's essential to note that these ranges are general guidelines and may vary depending on a person's age, health status, or medication use. So if you are concerned about the management of diabetes, whether you would want to do it conventionally or naturally, you seek the intervention of healthcare providers for guidelines. There are several types of diabetes, but we'll tackle the three most common types for today. We have type 1 diabetes, type 2 diabetes, and gestational diabetes. Type 1 diabetes is an autoimmune disorder whereby the immune system attacks the insulin-producing beta cells of the pancreas, which is responsible for the production of insulin. And this results in a complete deficiency of insulin production. What the deficiency in insulin means is that you will eat all right, carbohydrates will be broken down into glucose, but there will be no insulin to facilitate the entry of this glucose into body cells where they can be used for energy or be stored for later use. We also have type 2 diabetes, which is characterized by insulin resistance or impaired insulin secretion. Insulin resistance in type 2 diabetes is because the insulin is produced but not being properly used by the body to facilitate the entry of glucose into body cells. The body becomes less responsive to the insulin that is being produced. Gestational diabetes, which is the third one, also happens during pregnancy. It usually occurs during the second and third trimester, and this is because of hormonal changes or insulin resistance. I earlier on said that managing diabetes naturally involves lifestyle changes, dietary modification, and also natural remedies. The lifestyle changes are the adjustments you make to your daily habits or behaviors in order to improve your overall health. These changes can be exercising regularly, staying hydrated, maintaining a healthy weight, and then managing your stress. You can get enough sleep by aiming for 7 to 8 hours sleep per night to help regulate blood sugar levels. And then with the management of stress, you can practice stress reducing techniques like deep breathing, yoga, or meditation. Dietary modification is an intentional changes made to an individual's eating habit or food choices in order to improve overall health. So here you can focus on whole grains and unprocessed foods such as fruit and vegetables, lean proteins, and also healthy fats. You also try and eat low carbohydrate foods. You avoid foods that are high in sugar. You avoid saturated fats and also refined carbohydrates. Also try and incorporate diabetes-friendly foods like leafy greens, berries, seeds, nuts, etc. These are all foods that can help regulate blood sugar levels. Now, the natural remedies. Number one, we have berberine. Berberine is a plant-based compound that helps regulate blood sugar levels. We also have cinnamon. Cinnamon improves insulin sensitivity and also helps regulate blood sugar levels. Sensitivity is just the body's ability to effectively use insulin. And so we have chromium, which is also a mineral that can help improve insulin sensitivity and also help with glucose metabolism. Another natural remedy is alpha lipoic acid, which is also an antioxidant that can help reduce oxidative stress and improve insulin sensitivity. Turmeric can also improve insulin sensitivity and reduce inflammation. Herbal remedies such as ginseng, fenugreek, and beta-melon can all support this cause. In all of this, monitoring and maintenance is key. So you make sure you monitor your blood glucose levels regularly in order that you stay within a healthy range. Remember that while these natural remedies and lifestyle changes can help manage diabetes, they shouldn't replace the conventional medical treatment. So you always have to consult a medical professional or a healthcare provider before making any significant changes to your diabetes management plan. Time with Nurse Joycelyn. Kindly subscribe to my channel for me, like and share my videos, and keep your comments respectfully in the comment section for me. I'll see you in my next video.